Katsuhiko Akiyama's Periodontal Microsurgery Lesson 2. Number 1. There are two techniques for the microsuture in regards how to move the needle holder when performing periodontal microsurgery. I will explain the two techniques, the front side suture, the back side suture I named. For the microsuture in regards how to move the needle holder when performing periodontal microsurgery. Number 2. The correct positioning for the microsuture with the microendoscopic technique Akiyama method. I will explain how to positioning your body and align your forearm parallel to the incision. This will achieve an accurate microsuture with the microendoscopic technique Akiyama method. This lecture quote is from my book, The Microscopic Periodontology Procedure. This book is, I'm sorry, already sold out. So, number 1. There are two techniques for the microsuture in regards to how to move the needle holder when performing periodontal microsurgery. There are two techniques for the microsuture in regards to how to move the needle holder when performing periodontal microsurgery. When we use the egg grip, the front side suture is when we rotate our hand inward, and the back side suture is when we rotate our hands outwards. I will explain the advantages and disadvantages of each suture. The front side suture, Akiyama named. When we use the egg grip, the front side suture is when we rotate our hand inward. This is a movie. When we use the egg grip, the front side suture is when we rotated our hand inward. This is the front side suture. The front side suture's advantages. Very easy to control the needle's movement. When we penetrate soft tissue, we can clearly see the needle. Easily adjustable. The front side suture is easier than the back side suture. Number 5. We can perform the front side suture without the needle to cross over the hand. Number 6. There is nothing obstructing the surgical location. The front side suture is the basic suture in periodontal microsurgery. The front side suture's disadvantages. At times, the front side suture can be disadvantageous, making it easy to miss the ideal sutured path caused by the adjustability of our hands and the needle's movement. Number 2. It is impossible to use the front side suture for every surgical location. The back side suture, Akiyama named. When we use the egg grip, the back side suture is when we rotate our hands outwards. This is a video. When we use the egg grip, the back side suture is when we rotate our hands outwards. This is the back side suture. The back side suture's advantages. Number 1. The back side suture is very hard to miss the ideal suture's path due to the stable hands and needles movement. Number 2. The back side suture is the only alternative to the front side suture. If we can't use the front side suture, we must choose the back side suture. The back side suture's disadvantages. Number 1. Difficult to control the needle's movement. Number 2. When we penetrate soft tissue, it's a little difficult to clearly see the needle. Number 3. Difficult to adjust the needle's path. Number 4. The backside suture is harder than the frontside suture. Number 5. We can't perform the backside suture without the needle to cross over the hand. The hand and needle holder are obstructing the surgical location. The frontside suture is a basic suture in periodontal microsurgery. When possible, we should always choose the frontside suture over the backside suture. Number 2. The correct positioning for the microsuture with the microendoscopic technique again method. I will explain how to position your body and align your forearm parallel to the incision. This will achieve an accurate microsuture with the microendoscopic technique again method. By rotating the forearm, it can assist the A grip in achieving an accurate microsuture. Align your forearm parallel to the incision. By rotating the arm, it can assist the A grip in achieving an accurate microsuture with the microendoscopic technique again method. The microendoscopic technique again method allows the operator to change their positioning. This will assist the operator to achieve an accurate microsuture. The conventional surgical microscope technique keeps the operator seated in a 12 o'clock position, making it more challenging to achieve an accurate microsuture unlike the microendoscopic technique again method. At times, it may seem very difficult to align your forearm parallel to the incision. Over time, with experience, you can master the microendoscopic technique again method and will be able to achieve a high-level microsuture. Video demonstration. In this video, I'm performing the backside suture after harvesting connective tissue from the palate. In this procedure, I have aligned my forearm parallel to the incision using the microendoscopic technique again method. I stage the positioning while performing the backside suture after harvesting connective tissue. I have aligned my forearm parallel to the incision using the microendoscopic technique again method. In this video, I'm performing the frontside suture after harvesting connective tissue from the right palate side. This is the right side. In this procedure, I have aligned my forearm parallel to the incision using the microendoscopic technique again method. This is a frontside suture. I stage the positioning while performing the frontside suture after harvesting connective tissue. I have aligned my forearm parallel to the incision using the microendoscopic technique again method. Case. This patient's biotype is very poor. This is Akiyama's biotype 2 or 3. I will perform connective tissue graft microsurgery to improve the patient's biotype. This is a pre-surgery. This is a surgery video. As you may already know, performing microsurgery is a tedious and time-consuming procedure. Though, by using the microendoscopic technique again method, we can dramatically reduce the procedure time. Here, I am performing microsurgery on 8 teeth. Adjust after surgery, post-surgery 7 days. So this is a post-surgery 7 days. Good wound healing, no pain, no swelling, no bleeding. Pre-surgery, post-surgery 7 days. Good, very good result. The front side suture, the back side suture, the correct positioning for the microsuture with the microendoscopic technique Akiyama method. Thank you for your kind attention.